Hello and good afternoon. My name is Alison and thank you for joining us this lunchtime webinar on personal medical case management. We know that being inflicted with a serious medical condition is already an ordeal and can be one of life's scariest and most uncertain moments. On top of that, having to make critical life-changing decisions during this time can be very stressful and daunting. We know it's not easy and no one can be completely well prepared for it, but we hope that today's session will give you more information and better understanding on how personal medical case management can help support and improve your journey of recovery. Today, we have invited an esteemed panel that can help shed some light on personal medical case management and the unique access to quality healthcare you have as an AIA customer. Without further ado, please allow me to introduce our panelists. All the way from the UK, we have Ms. Sigal Atsmon, who is the founder and president of Medix Group. Sigal is a passionate and committed person to ensure Medix provides people around the world with innovative and advanced medical management solutions. And we have here with us in the studio, Mr. Warren Yap, starting his journey as a financial planner with AIA in 1999 and is now an AIA Financial Services Director of Warren & Associates. He manages a group of AIA Financial Services consultants who dedicate their efforts into helping their clients realize their financial goals. And we have with us here also Dr. Mona Jamtani, who is a personal medical case manager at Medix. She has significant clinical experience in a variety of medical fields and has been involved in various research projects and publications in leading international journals. Last but not least, we have Dr. Alan Ong, who is the Medical Director for AIA Singapore. He's a seasoned healthcare professional and has over 15 years of experience in the public and private sectors. With extensive experience in the Singapore healthcare system, he has worked as a clinician on the ground and across multiple portfolios in the Ministry of Health. I hope that today you will have an insightful session with our panelists, and not to worry, we will be having a Q&A session at the end, but you may submit your questions to us anytime during the session. On the right, you would find the button. But for now, before we start the discussion, let's have a quick poll with everyone. So the poll question is, what would you do if a loved one is diagnosed with a critical illness? There's a pop-up on the right of your screen, and this is a live poll, so everyone, please submit your poll results. We'll give a couple more seconds to get the results in. And it seems the majority of you have selected to seek a second opinion. So not many people really know what to do in times when you're faced with a critical illness. But perhaps maybe, Warren, what do you think of the findings? And I also know that you have a client who has gone through this. And do share with us a story of your client, or rather her little boy, who has suffered through a critical illness.
Yeah, sure. Thanks, Alison. Well, not surprising with regards to the poll. I mean, anyone struck with a major illness will always be concerned about what's the next best course of action. My personal experience with Denise and Alan, who have been long-time clients and friends of mine, not too far back, the son was very sick, and I was actually handling all their claims. The bills was coming from different places, from the government hospital, from TCM, from the private hospital. And each time I go and see them, they were very unhappy. They were very confused with regards to what to do next. So what happened was that the boy, Ben, son Ben, was sick. His stomach was bloated due to the amount of antibiotics he was having. And they were at a loss of what to do. So what I did was that I referred them to Medix. And Medix had a case manager assigned to them to take them through the journey with regards to their specific case. Denise was very helpful. In fact, she did a testimonial. And I would like to take this opportunity to share with you Denise's testimonial with regards to the experience with Medix.
Medix has helped my younger son, Benjamin, got out of a 2-year medical ordeal. Our family went to Hong Kong for a short holiday. Benjamin got a common cold there, and it requires antibiotics. But his wet cough just lingered on for 2 years. We thought just went to any doctor will be fine. But then he still didn't get well. Almost like every 2 weeks, I had to bring him go to a clinic. I tried so many doctors, Western doctor, Chinese doctor, went through so many tests. He didn't complain when he has to insert a tip through the nose to draw out the air from the stomach. I understand it must be a very painful process. And I did saw him, he got tears in his eye and he got hold his tears. So the last treating doctor, he began to suspect something more serious like chronic lung diseases or even genetic disorder. So it's at this point of time when we felt very lost and hopeless.
Well, as you can hear from Denise's personal testimonial, her journey has been a positive one. The case manager contacted her, put together all her reports, forwarded to the expert to do the analysis. The case manager is always on call 24/7 to walk through the journey with them. What is even better is like Dr. Mona here. They are assigning a doctor to actually look at the case. There's also a case nurse that will actually walk the journey through with the client during the treatment phase. Just before the circuit breaker, I met up with Denise and Alan, and I saw Ben was looking a lot better. You know, his bloatedness was no longer as obvious. He's definitely on the road to recovery, and I do wish them well and recover soonest.
Thank you, Warren, and glad to hear that little Ben is doing much better and is happy and a healthy boy now. So over to Dr. Alan. Well, AIA is known for its comprehensive health and healthcare support for its policy holders, and I was wondering what are the key differentiators, and can you share a little bit more about Medix and how it sits within the AIA healthcare proposition?
Yeah, sure. So the basic idea behind how AIA approaches health insurance is that we want to move from simply paying claims to becoming a partner to our customers along their entire healthcare journey. And you can divide the healthcare journey of anybody into 3 main parts. So the first part is we want to stay healthy. Right? And the second part is that when we fall ill, we want to get the right treatment as quickly as possible. And the third part is after we complete our treatment, we need to make sure that we get ourselves on the road to recovery. So when it comes to staying healthy, the key offerings that AIA has for our customers are AIA Vitality, as well as screening benefits for our AIA Health Shield customers. And basically, we want to invest in our customers' health and help them stay healthy in order to fulfill our brand promise of helping our customers live healthier, longer, better lives. But not everyone can stay healthy forever, and despite the best of efforts, all of us will fall ill from time to time. And that's where other parts of our healthcare offering come in. So we have a panel of specialists so that you can quickly find an appropriate doctor for your medical condition. We offer a pre-authorization service so that you can get assurance that your claim will be paid when you need to seek treatment that requires a claim. We also have partnered with White Coat, which is a primary care or GP teleconsultation service, so that for more minor conditions, instead of trying to see a specialist, you can simply and quite easily contact GP through teleconsultation. And finally, what we're here to talk about today, we have Medix, which is a service that's intended to support customers who have more complex conditions and who may require, say, the services of multiple specialists to sort out their problem. So that's getting you to the right treatment as quickly as possible. And then finally, on getting you on the road to recovery. So after treatment, many people will require a period of support in order to make sure that they recover properly. After surgery, for instance, you will require help with various changes to your daily living and so on. You may require therapy. So again, Medix can come in quite handy for customers who are in this position, because Medix provides extended support for our customers who have fallen ill. And I believe there's a video which we have, which will help to illustrate how AIA's healthcare proposition works.
Hi, I'm John. Like you, I worry about my health, especially about falling sick. High medical costs, and it's expensive to live healthy. So I met with Tim from AIA Singapore. He evaluated my needs and shared just how vital the right support at each step is, especially if I end up hospitalized. I knew then that AIA is the right choice. Last year, I was hospitalized with severe back pains as advised by a specialist from AIA's panel of doctors. Tim was amongst the first to visit. He assured me that there'd be no shocking bills. He had already gotten my treatment pre-approved. I got to rest, not worry, and recovered swiftly. He also reminded me about my complimentary access to Medix. Together, we got the right diagnosis and treatment. They were there with me throughout.
Now that we understand a little bit more about Medix, let's hear from Sigal, the president and the founder of Medix herself, and tell us more about Medix. So, Sigal, you've been leading and the continued growth of Medix since its launch in 2006, and Medix has now over 300 in-house doctors and 4,000 top specialists across the globe. Very impressive, and across the accredited network of 2,000 medical centers. For those of us who are not familiar, perhaps you can help explain and describe a little bit more about Medix and why did you choose to partner with AIA exclusively? Sigal?
Hi, I'm very happy to be here today and very proud to share a little bit about Medix. So maybe I'll start with the story of why we created Medix. So many years ago, when I was young, I wanted to be a doctor, but I didn't go through medical school. And I had a great career, 3 beautiful children in the world of finance. And at a certain point, I got to the age where I had to have my first mammogram. And I was on the way to the clinic. I got inside, I was seated, and I was waiting for my turn, right? And I was on the phone. As a businesswoman, I'm always on the phone, always very busy. And there was background noises. And this lady on the phone speaking to me is actually asking me, "Where are you? What is this noise?" And I said, "Well, it doesn't really matter. I'm going to have my first mammogram." And she said, "Are you afraid?" And that question actually hit me that moment. And I told her, "No, I'm not afraid at all." But actually, I realized I was, because I suddenly understood that a minute away, or maybe 15 or 20 minutes away after my test, my life could have been completely changed and completely shattered. And from a healthy, great executive businesswoman, I might become a patient who needs to realize, understand, and make sure that the diagnosis is correct, that the treatment she's going to choose is the right treatment, that the right doctor has been approached. Which kind of doctor? A breast surgeon, an oncologist, radiotherapist? There are so many options. And it hit me that people who are diagnosed with serious medical conditions are very confused, anxious, stressed. There's so many decisions that need to be made. Do they have the tools to make those decisions in the best possible way? So at that point, I decided to make a change in my career, and actually, I founded Medix back in 2006. Understanding the triangle between the insurance company, the payer, the provider, which is the treating doctor, and the patient, that there is a real need for people to have advocates, for someone to objectively look at their case, everyone with his own different medical condition, serious medical condition, and someone that would look at it and make sure that the person has gone through the right tests, that they have been referred to all the tests, that the right diagnosis have been achieved, that the right treatment and the different treatment alternatives have been offered. I want to give you an example. If you take, and I'll go again to the world of cancer because it's just an easy example, but take prostate cancer, right? Very common cancer. People don't realize how many different treatment options there are when you need to decide what you do as a gentleman if you have prostate cancer. And I would be happy to ask the crowd, but unfortunately I'm not in front of you really. So let me tell you, there are about 8 to 9 different treatments. How do you make your choice? How do you know you saw the right doctor? So that was the moment where we decided that we're going to create a service that actually supports people in making those right decisions, evidence-based, objective, quality-driven decisions. And that's how we created the personal medical case management service. It actually, by initiating the service, you get appointed a dedicated nurse and a dedicated doctor who are going to summarize and review your case and send it to world-leading specialists for additional consultations. From there, we will look at what is the right diagnosis, recommend the right treatment alternative, and support you through the whole process of making sure you get the right treatment all the way to rehabilitation. So this is something I'm really, really proud of. And we've been growing tremendously. We've been providing service in over 90 different countries across the world, working with thousands of world-leading specialists. And we're very proud to make a real difference for Singaporeans in Singapore.
Thank you, Sigal. And on that note, what is the relevance of Medix in this COVID-19 environment? And perhaps you can share with us a little more about that.
Sure. So I can share that the COVID-19 obviously has taken a terrible toll from an economic and human perspective across the globe. From a healthcare perspective, in the healthcare insurance and in the healthcare landscape, actually the demand has grown tremendously. People have understood that remote medical support, including telehealth, including services that you can actually obtain from the comfort and the safety of your home, have become the norm. People are reluctant to go to clinics, and the demand has grown tremendously. We have seen hundreds of percentages of growth across the world and in Singapore as well in demand for our services, because people want to make sure they get the right diagnosis, the right treatment, and they can do as much as they can from the safety and the comfort of being at home. No need to always go and see a doctor face-to-face in a clinic. You can make sure to upload your medical reports, to upload your imaging to a dedicated imaging system where you can share your MRI or your CT scan or your ultrasound. You can have video chats, you can have calls, and you can discuss most of your clinical issues over a remote and digital solution. And this is what we're providing. So people are really excited, and demand is growing, and it has supported a lot of people because people need healthcare, and they should not defer healthcare. They should just be able to get it in the right way, and sometimes remote is just perfect for them.
Thank you, Sigal. I mean, in such unprecedented times, healthcare is definitely on the top of everyone's minds. And interesting that you mentioned telehealth. Perhaps over to Dr. Allen. You can share with us what's the difference between Medix and White Coat, another one of AIA's healthcare partners.
Yeah, sure. So both White Coat and Medix are telehealth solutions in the sense that you are being delivered a service remotely rather than in person with a doctor. I think there are two main differences between White Coat and Medix that it would be helpful to clarify. So the first is that White Coat directly delivers service. So it is a primary care teleconsultation service. You are seen by a doctor who then directly prescribes you whatever medication you need, performs a diagnosis, and so on and so forth. Right? Whereas Medix, what Medix does is Medix helps to connect you with relevant leading specialists from around the world so that they can verify your diagnosis and then works with whoever is your treating doctor locally to make sure that you get delivered the most appropriate care. So that's difference number one. The second difference is that White Coat is meant for primary care conditions. So you are seen by a family physician, and the family physician is equipped to manage common conditions like cough and cold, minor gastrointestinal upsets, or other primary care conditions like chronic conditions such as diabetes. So that's White Coat. Medix is intended for people who have more complex conditions. So let's say you have cancer, or you have very persistent back pain that is not resolving, or you have you have a serious cardiac condition. So these are situations in which Medix, with its access to international experts, can help you by verifying that you have an accurate diagnosis and guiding you on the appropriate treatment.
Thank you so much, Dr. Allen. And now that we have a better understanding of what Medix is and also White Coat, perhaps let's go into another poll now. And let's see. What would you be most concerned about if one of your loved ones was diagnosed with a critical illness? I'll give a couple more seconds for you guys to fill up that. And wow, 72% of you had said unnecessary or incorrect diagnosis. So that would be the key to it. So really, in our line of work, these concerns are very real, and 3 in 10 are obviously concerned about unnecessary or incorrect diagnosis. And at the same time, also 3 in 10 are concerned about the lack of personal healthcare support and lack of coordinated care, according to our research. And let me just stop everyone here for a moment, and perhaps you can start submitting your questions to us that we can answer at the end of the session. And while we're doing that, let's turn our attention over to Dr. Mona. Hi, Dr. Mona. Perhaps, would you say Medix is a way of providing a better second opinion? Do share with us a little bit more about that.
It certainly is, and as Warren has mentioned, and Dr. Allen has also mentioned, that it is more than just a second opinion. So when you have a health problem, you go see a doctor and you get a diagnosis and a treatment plan. And as the earlier poll showed us, that if you're diagnosed with a critical illness or something that's rather complicated, your next step would be to seek a second opinion. And this second opinion will be a consultation with a different specialist in the same field, and it will take about 5 to 30 minutes, and they will give you perhaps the same but perhaps different diagnosis or a different treatment plan. And then after that consultation, you're left to decide which treatment plan you're more comfortable with. And so there's no support there, and you kind of have to just understand it and sort of understand what your problem is and choose treatment that would work best for you. So how Medix is different is not only do we provide the recommendation. When you first come to us, you're assigned a medical coordinator nurse, you're assigned a case manager who will work together, work with you, talk to you, understand what your situation is, get your complete history, get your complete medical records and see what your doctor has offered. And then we will do a consultation with leading global experts, and we will give you the recommendation. And through this, we will not only give you a recommendation, but also a referral to a specialist locally, a leading specialist locally, for you to get the treatment that's been recommended. And as we're going through it, we're always there. Your case manager is there to help you process the information and pick the best treatment for you. And Sigal has explained this really well. And parallel to her situation, we do have a case that's quite similar to that. And that is this lady who had a few episodes of blood in her stool, and she went to see a doctor and was advised to do a colonoscopy. So she came to us because she didn't want to do the colonoscopy. She was quite sure that it was her hemorrhoids that was acting up, and she felt like she probably wouldn't need it. And we looked at her case, we looked at her records, medical diagnostic tests that she had done, and we advised her to proceed with the colonoscopy. We provided her a referral for a gastroenterologist, and after the colonoscopy, they found a cancer. She was a rectal cancer. So as Sigal said, now at this point, she had no incline to, she was not prepared for this. She thought it was a hemorrhoid, and so this is a big diagnosis for her, and the treatment would mean that she would be shuffled. So from the gastroenterologist that did the colonoscopy, she would have to go for imaging. So she will see, after the imaging, she will see maybe a surgeon or an oncologist or a radiotherapist. And in this journey, you see 3 to 4 different doctors. And so there is continuity of care, but it's always a different person. Whereas with Medix, as we provide you recommendations from different leading specialists, you're still talking to your case manager, which I think, it really helps because there's a connection there, and the case manager understands what you're going through and helps you to digest, to process all the information that's coming. And it really helps the patients, I think. And when it comes to that, right, once you are diagnosed with cancer and you see a surgeon, when do you seek second opinion? Do you get a second radiology opinion, or do you get a second oncology opinion, or do you get a second surgical opinion? And then you'll have to see 6 to 8 different doctors then. With Medix, you just speak to your case manager, and your case manager will consult for you and provide you the recommendations, walk you through it, and as you go along from one specialist to another, we're always there. we're always supporting you and we're always helping you. And if the treatment, for example, is not working out well for you, we're still there. You can still come to us. And if, in case, it takes a few days, obviously, it takes a few days for the diagnosis to sink in. And if, maybe the patient suddenly has a concern like, oh, is this genetic? Am I going to give it to my kids? We're always there. We can help you answer these questions as well. So I think Medix is definitely more than a second opinion. It's an experience, and I find that it's really helpful to the patients. And in this case of the lady with the rectal cancer, actually she had colorectal cancer, and she just went through surgery successfully. So it's a pretty nice story. Well, it's not. It feels nice that we were able to be with her throughout this very worrisome journey.
Thank you for sharing, Dr. Mona. Glad to hear that your patient's getting better and that Medix has helped her through the journey. So now that we understand a little bit more about Medix, perhaps let's get our panelists to discuss and how Medix works and what makes it more outstanding in terms of providing these services to the AIA customers particularly. So AIA customers may have some questions which they would submit through the portal. But in the meantime, maybe a question to Warren.
Yep.
What is the biggest misconception or hurdle that you and your customers will face when it comes to Medix?
Okay. Well, I think first, you don't know what you don't know, right? And that's the most difficult part. Like Denise's case, she didn't know that there was even Medix. I would say that the financial services consultant that you're working with plays a big part in the whole relationship. And now, of course, with this webinar, you are informed that there is Medix. And there are many ways to reach out to us to arrange for a Medix consultation. Of course, I'm not going to recommend clients with common cough and flu to Medix because those can be done at a family GP. Typically, situation where things are a bit more serious, like for example, cancer, or maybe like Ben's case, which is a bit more complicated. There was no specific diagnosis. I think that will be a good example where we direct the case to Medix to get them to help, to provide their expert opinions with regards to what they need to really do. Right? Yeah, so that's I think will be the biggest hurdle, if I would say. Yeah.
Thanks, Warren. Over to you, Dr. Allen. Are there any other stories you can share with us about how Medix has successfully helped customers?
Yeah, sure. I mean, I think how I would describe Medix is if you think back to the days before Google Maps, when we were still able to travel because it was before COVID, when you went to a foreign city, the first thing that you had two choices. You could either buy a paper map and then you try and figure your way out around on your own, or you can get a tour guide. So in a sense, healthcare is very complicated. And when you have a medical condition, it's like landing in a foreign city and you have no map. So you can either buy a map yourself and try and figure it all out. And those of us who have traveled will know that sometimes it works, sometimes it doesn't really work very well. Or you can engage a tour guide, and and ideally you engage a tour guide who works for you rather than works for one of the people, one of the tourist attractions that you're trying to see. So that's the analogy that I would draw just to help people try and understand what Medix is about. Now, in terms of how AI customers benefit from Medix, I think one key thing that I want to highlight is that the opinions, the assessment that Medix does are completely independent from both the healthcare provider that you're seeing as well as AIA, the insurer. And the reason why this is important is because we want the opinion from Medix to be completely free from any sort of bias and to be based purely on what is appropriate for your medical condition rather than any other interest that either your healthcare provider or the insurer might have. So, going back to the analogy of the tour guide, there are good tour guides and bad tour guides. If you engage a tour guide who has some kind of arrangement with, the restaurant that he or she recommends and so on and so forth, then you obviously get a suboptimal experience. But if you engage a tour guide who works for you and does not have any sort of arrangements with the restaurants or the gift shops or the tourist attractions that you're going to, then you tend to get a better experience when you travel. So I think we've also prepared a video of one of our customers who's benefited from Medix service. So I think it'd be helpful if we could play that now.
My mom passed away due to cancer also when I was 21. Having already lost your mom to cancer, I'm like, no, I'm not going to lose my dad. My dad got a small growth on the knee. He didn't think of it as something, but it started to grow in size after it was removed through a surgery. That was when we received the bad news that it was actually cancerous. The doctor said that, although it had been removed, but it was not to the industry standard. My dad got this advice from the hospital to go for a second round of surgery. The first question that I asked was actually, do we really need to go through another round of surgery? I mean, who would want to go through another surgery if it can be avoided? Really, the first thing that came to my mind was, no, we have to call Medix.
Thank you, Dr. Allen. And I hope Happy and his family are doing much better now. So perhaps now that we found out a little bit more, perhaps Dr. Allen Warren, we can discuss about from an AIA customer's perspective, how can they tap into Medix? Because probably that's the burning question for most of our audience today. Perhaps to Dr. Allen, when should customers use Medix?
Yeah, so I think customers should consider using Medix when, if you've seen a specialist a couple of times and you don't have a clear diagnosis, or if you have been diagnosed with a relatively serious condition by a specialist, or just when you're not sure whether the treatment that the specialist is offering you is the correct course of action for you. So these are all conditions in which, circumstances under which you should activate Medix. And how you can get access to Medix, I think there are basically 3 ways you can do this. You can call Medix yourself, that's a telephone number for that. You can email Medix to get a case open, and I think the easiest way and the way in which most of our customers do it is really to tap on the services of your AIA Financial Services consultant, who will be able to get in touch with Medix and open a case for you.
Yep, and also perhaps Warren, you can share with us a little bit more about how the customers get started with Medix.
Well, okay, so first, of course, you have to be a client of AIA, right? That's a good start. I've been in the financial advisory for the last 21 years, and this is one of the service that I feel is really useful for clients. Okay, so of course, it's not just all clients, it's very specific to the products that you purchase. So for example, most of us would have our Health Shield Gold, which is the integrated plan that is incorporated together with the MediShield Life. Okay, but that's not good enough. You need to purchase the riders. So of course, you have the Vital Health A, the Essential A, and of course the A Saver. Right? And those are typically the medical plan that most of us carries. Of course, there are other standalone products, like for example, Beyond Critical Care, and of course the Power Critical Cover, which is the critical illness plan. Okay, and guess what? When you are a client with AIA owning all these products, the service is complimentary. You don't have to pay a single cent, right? And just by listening to this, a service like that is not going to be at a low cost, right? And AIA is going to cover this expense for our clients who own those products, right? And of course, for me, this is not just about insurance sales. Example, Denise and Alan, they have been my clients for the last 15 years. So it's not just about selling them the insurance policy, but also ensuring that if things like that ever happen to their child, there is a support at AIA that can actually take them through the treatment of their child. Yeah.
Thank you, Warren. And well, maybe to help the AIA customers sum it up, we'll go back to Sigal back in the UK, if she could tell us any insightful stories about how Medix has helped their customers as well.
Sure. So actually, I wanted to go back to the story that Dr. Mona Jamtani shared about the lady who thought she had hemorrhoids, and she wouldn't, she would gotten a treatment because she did have hemorrhoids, but she had other problems which she didn't even think or was aware of. And it's the first instinct to go and say, okay, there are hemorrhoids, that's why she's bleeding. You must understand that getting the diagnosis of colorectal cancer is crucial for survival. It's not just that we found the right diagnosis. Medix actually, in this specific case, saved her life, because if you catch it in the beginning, it is still resectable, it's treatable, and you can be cured. If she would have thought that this is hemorrhoids and be treated with her for her hemorrhoids, which she had, but deferred, and it wouldn't be realized or confirmed that she had also a tumor, colorectal cancer, the cancer would have spread and it would have been more difficult to treat, and maybe it would have metastasized and not be treatable anymore. And unfortunately, colorectal cancer is not an easy cancer to survive, and she could have given her life to it. So it's not just getting the right diagnosis and the right treatment, it's getting the right diagnosis and the right treatment on time. And that is a triple real way of making a difference. I would like to share that in over 22% of the cases that we manage specifically for AIA Singapore in Singapore, Medix has changed the diagnosis. So take a room full of 100 people that went to see a doctor and got a serious medical condition. A quarter, on average, every year, a quarter of them were going to be treated for a wrong diagnosis. Now, I'm absolutely not saying the healthcare system in Singapore is not a very good one. It's one of the world's best ones. But when you see one doctor who has a limited number of time, it's just what you can get from one person. And it's sometimes limited. In 63% of the cases, can you hear me well? Everything's okay?
Yes.
Okay. In 63% of the cases, we changed and recommended a more optimal treatment option. 63% is a huge number. When we created Medix, we never thought that in healthcare landscapes like in Singapore, which are so developed and where you can have access to such good quality care of medicine, we would have such unbelievable and life-changing results. Last and not least, I would like to say that in the beginning, people in this broadcast have shared that the first thing they would do is get a second medical opinion. Now, one of the added values that Medix brings is when you go and have a second medical opinion, what happens if it conflicts with your treating doctor's opinion? You have your doctor that you had chosen, and then you go and have a second opinion. And that second opinion tells you a completely different solution. What do you do as a patient? Without Medix, you don't know. You don't have the knowledge. You don't have the objective tools to make a decision who's right and to choose. You need to have someone at your quarterback. And just to summarize my take on this, can I have one more minute? Okay. So very quickly, I would like to share Steve Jobs' story. So as you all know, Steve Jobs was the founder and the CEO of Apple. Unfortunately, he passed away due to pancreatic cancer. Pancreatic cancer is a very difficult disease to overcome. Now, we all know that Steve Jobs changed our lives. We have our phones and all the nice gadgets. The whole world wanted Steve Jobs to stay alive. Every doctor in the universe wanted to find a way to help him out. And they had all the finances, unlimited, the connections, opening doors. The doors were open for him everywhere. Thousands of doctors tried to help him, but it didn't work. If you read the biography, the book that he wrote that was published just after he passed away, his wife shares the healthcare experience. And she actually says there that what is missing and what they missed as a family, the Jobs family, is a case management service, case workers at the quarterback of every patient to support them to have a holistic approach to the situation, because they had so many different doctors on board, so many different opinions. She had to sit down every evening and put everything together and to try to look at the big picture, and no one would do that for her. So this is exactly where Medix comes in, to look at all the different opinions, get additional ones, order them up together, summarize them, and together with the patient and his family, because the family plays a crucial role here, make the right decision and help them implement them and support them through the whole process of complications, side effects, how it is to be home. You can call your doctor and your nurse 24/7 for your Medix service. If Steve Jobs and his wife felt that they needed it, I feel that we did something and that we do something that is right. That is my take on it.
Thank you so much, Sigal. That was a really insightful story that you shared with us, and I'm sure that it's something that when it comes down to it, it will be very important to everyone that they have access to Medix. So we've come to the end of the session. Before we enter the Q&A session, I guess I just wanted to summarize that Medix is really more than a second opinion, and it's very important that we have multiple second opinions, but in the case of the case manager, they will help you make sense of these second opinions and guide you to a decision. And also, importantly, as Warren said, not all AIA policies have this service, so please check with your financial services consultant and seek help on getting in contact with Medix if required. With that, I would like to end the session and go directly into the Q&A section. I think a lot of you have submitted questions, so I'm very glad to hear that so many of you have some questions. So let's go through the questions, and perhaps the first one would be to Dr. Allen. Does my condition have to be severe to go to Medix?
So your condition doesn't have to be severe to go to Medix. We're not saying that you need to wait until you are close to the end of your line before you go there. I think where Medix can make the most difference actually is when your condition is not that severe. So it's like the example that Dr. Mona gave of case getting picked up early. So that's when Medix can make the most difference. Where I would suggest that you consult or how customers can think about triggers for consulting Medix are, okay, if you've seen a specialist and you don't have a clear answer on what condition you have, you've seen 2 or 3 specialists and they have conflicting opinions on what treatment you should get, or you have someone who's advising you to undergo quite significant treatment, so a surgical procedure, or to get admitted for a procedure, and you want to know whether this is the right course of action for you.
Thank you, Dr. Allen. And the next question,
if I may, just very
go ahead,
shortly,
Sigal.
because we spoke a lot about cancer. It's not just for cancer patients. It's for orthopedics. Do you need to have a knee surgery or a spinal surgery? So many people suffer from orthopedic pains, chronic pains, and at some point they feel they just want to go through with surgery. And they don't know that there are so many different alternative treatments today for orthopedic conditions. So we don't do just cancer. We do all the different diseases from all different specialties. There are just very few things we don't do, exclusions, like obstetrics, like neonatal care or psychiatry or cosmetic care or dental care. But for the rest, all conditions that may impact the quality of your life or the length of your life, God forbid, are eligible for Medix. And you should turn to us to make sure you make the right decision.
Thank you, Sigal. And maybe perhaps over to Dr. Mona. One of our viewers would like to know if all Medix case managers are doctors.
Yes, actually all Medix case managers are doctors. So when you call in and you speak to your case manager, you can rest assured that there is an experienced doctor behind the phone that is talking to you and trying to help you. So definitely yes. You can relax. We're all doctors here.
Good to know. So perhaps Dr. Allen, you can share with us the answer to the next question. May I know what is the relation between AIA and Medix and White Coat? Are they in-house and only exclusive to AIA?
Yeah, so White Coat and Medix are 2 separate partners that we work with in order to provide a comprehensive healthcare proposition for our customers. They are not in-house, so neither Medix nor White Coat are subsidiaries of AIA. We don't own any stake in either of these 2 companies in any way. And I think the important thing is we let both the Medix service as well as the White Coat service run independently. So in no way does AIA attempt to influence any of the policies or decisions or recommendations that Medix provides.
Thank you. And perhaps, Warren, you would like to share with us the answer for the next question. Which AIA policies qualify for Medix? Do I need to pay extra for Medix? And can I tap into Medix if my policy doesn't provide this service? And how is it chargeable?
Well, okay, I probably can take the first two parts.
Yeah.
In terms of the product, obviously you have to be an AIA client. The product is namely the Health Shield Gold with the rider. And the rider has to be very specific. It has to be the A riders, meaning the Vital Health A, Essential A, and A Saver. Okay. If you do have policy that covers critical illness, like the Power Critical Cover, you are also entitled to that service as a complimentary service. The other one, of course, is the Beyond Critical Care, which is a very unique product just for people with diabetes. So only this selected class of products is available for Medix services. But the part on the, if we can tap onto Medix, I'm not sure, maybe Mona? Can they tap into your service direct?
Yes, so you can directly approach Medix personally. You would have to pay a chargeable sum, which is quite a large sum of money. I think maybe Sigal might be the best person to explain how the personal consultations will go.
So maybe first I would like to share why we work with AIA and why reaching out directly for Medix, I hope, is not a needed option. The reason we work with AIA, first of all, is because it's the leading and definitely a very, very big life and health insurance company in Singapore and across the region, because we have a regional strategic partnership across the region with AIA. Now, thanks to that, Medix has a very vast reach to enable as many people as needed to have access to our services. Now, AIA has realized long time ago that it doesn't just want to be like every other insurance company and just pay claims, right? Or give very good service when you call them into their service call centers, because every insurance does that. AIA wants to stand out by doing more for their customers, by making sure that when they have a serious medical condition, there is an independent support system that works along as a partner with AIA to support them through that very challenging period in their lives. That is why we have made the service available to as many possible policyholders across AIA Singapore book of business. So I don't think that there is a need to come directly to Medix, because so many people through AIA have access to our services. And this is what we're driving, for more and more people to have the right policy, the right protection. In these pandemic times, it is clear to everyone how important it is to have health protection. So my message to everyone is get your health protection right. And by having your health protection right, you will surely have access to Medix. And this is the way forward.
Thank you, Sigal. Since we have you, let's take the next question as well through Sigal. Why do I need a case manager? And does the case manager stay with me throughout if I have different cases at different times?
Yes. So first of all, it is very important to have a case manager team, a case team. The case team comprises of a dedicated doctor and a nurse. These teams know your case, know your medical reports, know your lab tests, know your imaging. They know your pains, your complaints, your emotional state, your family history. You don't need to repeat your story every time you come back and speak to them, or as you would walk into a clinic with a doctor, he needs to look back. They only manage a certain limited number of cases, and they're available for you throughout. When you have a doctor, you can't call him in the evening, in the morning, or before you go to see your doctor. You need to prepare the questions when you're back home after surgery. You have additional questions. You have someone at your quarterback supporting you all the time. This is the first thing, why you need a case team. And it's important to have both a doctor and a nurse. Now, the second part of the question was, would that team be available for me on a long term? So yes, it's a very good question. Every case is for a minimum period of 3 months. People with longer conditions that take longer to heal from or to cure from can have a case service for 3, 6, 9 months, even sometimes 1 year. We have patients that get our service for 2 years because they have complicated diseases that need multiple decision-making at different points of time because the disease progresses or the situation changes. So we would extend the case service from 3 months to additional 3 months as long as needed until full rehabilitation. And this is a very big difference compared to just having a second opinion, for example. So it's a long-term service, and it's a very personal and dedicated service. And you always speak to the same doctor and the same nurse. I hope that answered your question.
Thank you, Sigal. That's very, very clear. So I think the next question that some of our viewers had was, is Medix a free value-added service for AIA customers, or is it a paid service that we can engage if afflicted with critical illness? Perhaps Dr. Allen, you can help us with that?
Yeah, sure. So Medix is a free value-added services for our customers if you hold plans that Warren has mentioned earlier. So Health Shield Gold Max A with any of the riders, Beyond Critical Care, Power Critical Cover, and I think, yeah. So if you have these plans, you don't pay anything to open a case with Medix. You're not charged anything.
Yep. And how is it chargeable? I think that was covered by Sigal earlier. And perhaps let's move on to the next question. What is the process of opening a case? Will there be reference to a physical visit to another specialist, or the process is about reviewing the medical notes? Perhaps Dr. Mona, you can help us with that.
All right. So when you call into Medix, our customer support team will answer your call and will walk you through the service, so how long the service period is and what we offer. And then they will be asked to sign consent forms. And these consent forms are very important because your medical records are confidential. So by signing these consent forms, you allow us to access your medical records and consult our global leading experts regarding the conditions that you're experiencing. After that, you will be contacted by your medical coordinator nurse within one day, so within 24 hours, so the next business day, your medical coordinator nurse will call you, get a history, get to know you, and then they will collect all your medical records, and they will arrange for a call with the case manager, who, as we've discussed previously, will be a doctor who is quite experienced. And so you then will speak to your case manager, and this then will be, all the information that you provide will then be assessed, and a case will be built upon all the information that you provide. Following that,
maybe I'll just add an important point there, because we were asked whether we would refer patients. And if I may interfere, it's important because obviously we will consult and review your every case by a radiologist if there is any imaging, sometimes by a pathologist if pathology has been done and pathology review is deemed. And sometimes we will consult with 3, 4, 5, or 6 different specialists in Singapore or abroad based on the necessity of the case, the complexity, the rarity, etc. So we would reach out to world-leading local or global experts. They will remotely review the case based on all the medical information that we would have summarized. However, if we feel that the patient should be physically checked, and again, and another time by a different doctor than his treating doctor, because there is a question mark, we would arrange that referral, and we would offer 2, 3, or 4 doctors' names that we recommend that have been quality accredited by our objective, independent quality assessment team, and we will organize and book all your appointments, make sure the doctor knows you, make sure he gets the medical reports before you get to the clinic, and actually would streamline that process in a very easy way. So yes, if we feel that from a medical perspective you need to be seen by an additional doctor, we would make that referral, we will coordinate the appointment, we will make sure the doctor knows who you are, why you come to see him, and we will speak with the treating doctor and this additional doctor if needed to get a combined, joint, mutual agreement of what is the right way forward. I'm sorry I've interfered. I guess I'm just too passionate about what we're doing.
It's okay, Sigal. I think everyone appreciates you jumping in with your passion and your detailed answers. Okay, over to the next question. Maybe Warren, you can help us with it. Is Medix available for corporate clients?
Okay, I suppose the question is probably leading to a group insurance. So at this stage, I don't think we are offering that to our corporate clients yet. It's just the specific product that I shared just now. So it's just those plans.
Thank you. And also, perhaps the next question to Dr. Mona or Sigal would be, how are case managers helping as doctors but are not specialists? Can you share some examples?
I think
You want me to
Sigal
take it or do you want to take it? I'm
go
always
ahead,
happy.
Sigal.
I mean, I woke
Go
up
ahead,
so
go
early.
ahead.
I woke up so early in London for you, so I might as well, give everything I
Yes.
have.
Definitely. Go ahead.
So it is very important to understand that our case managers are one of the three. They're either GPs, experienced GPs, very good ones, or internal medicine specialists. These are people who work, who have made a specialty in internal medicine and worked in wards, or are pediatrician doctors. The reason for that is that these people have a very broad understanding and view of medicine, and they have been exposed to various cases, and they see complications of internal medicine, of oncology patients, of infectious diseases, of a very broad spectrum. They know how to run a proper multidisciplinary discussion, and they know how to engage with the different specialists, right? If you work in a ward, in an internal medicine ward, the general ward, and you have a patient that has suffering from different conditions, you would call in specialists for consultations, right? Gastroenterologists, neurologists, etc. In this case, this is exactly what they do. They work through our research department, who is the brain of our company, and they would reach out together to those world-leading specialists, getting the different advices from 5, 6 different doctors, combining it into one holistic approach is exactly the capability of an internal medicine specialist or a very experienced GP for adult people or a pediatrician for children. So the choice of having these people on board is a thought through choice, and we made it because we know that by combining the expert knowledge of those specialists in Singapore and abroad with the holistic approach and the understanding of managing a case from an internal or pediatric approach is the right approach. Together, they form a multidisciplinary winning team. I hope that answered your question.
Thank you, Sigal. That was very comprehensive. Over to the next question. Is there a prerequisite to initiate a Medix consultation if I have an eligible policy? Do I need to provide authorization for Medix to access my medical records to start? Perhaps Dr. Allen, you can help us with that?
Yes, so when you contact Medix, they will need your authorization in order to retrieve your medical records so that they can start processing your case. And I think maybe Mona could talk a bit more about how the process works when you open a case.
Okay, so actually, maybe I'll pass it on to you again, Sigal.
Sure, no problem. I'm happy to jump in. We are very compliant with different privacy rules, information security requirements, completely GDPR compliant and compliant with the different global and local Singaporean health protection and information security regulations. This is why when you want to sign up a Medix service and initiate it, you have to sign 2 forms. One, a consent form that you understand the service, that you are willing and wanting to use the service, and that we establish an independent relationship, which is a legal relationship, okay? It's a legal framework between Medix and the patient, all right? So AIA is not involved in an ongoing case, and it will not have any impact on your claims or any decision that is related to AIA. By using up and taking up the service as an AIA eligible person, you immediately initiate a relationship with Medix directly. In order for us to execute upon the needs of the patient, we need the patient's authorization, and he needs to sign that form that he allows us to, 1, retrieve his medical information, 2, to share his medical information with any doctor we deem necessary in order to help him out, to make sure that he reaches the right diagnosis and that he has been offered the different treatment alternatives and that we can refer him to doctors. Without having those two papers signed, we will never start a case. So it's an acceptance of the service, it's a confidentiality waiver to share for the purpose only of the case and for the purpose of improving the health situation of the patient, that we would share that medical information. At that point, we also share our information security policy so that the patient understands exactly how we make sure that his personal medical information is kept private and safe. The last thing, and it's not less important, is we will not initiate any case if we don't have access or we don't have any medical information. So the patient has to have gone to see a doctor, and there needs to be some tests that have been done or a medical report that we can base ourselves on so that we can initiate the case. We are not treating doctors. We do not operate, we do not inject, we do not prescribe. So we need to make sure that we have medical information that we can base ourselves on, and we're happy to retrieve that with the authorization of the patient. So these are the three things that need to be done: confidentiality form, acceptance of form of initiating the service, and access to medical records. Besides that, if you're eligible and you have a serious medical condition, no matter what it is, anything else than a flu or a stomach bug, you can approach us.
Thanks, Sigal. Follow-up question to that. I think everyone's really quite interested how they can have access. So does Medix work with local hospitals to access my records and test results to provide more accurate guidance? And how does Medix do this? So perhaps, Sigal, you could follow up with this.
Sure, I'll follow up. So we know how to work with not just hospitals we have relationships with. Obviously, the medical record is owned by the patient. By law, a patient has the right to have access to his own personal medical information. By signing the confidentiality waiver form, it allows us to approach any doctor in any hospital to obtain the necessary medical information. In most cases, we don't need to do that because the patient has received reports or has access already to the medical information, and he sends that through and he provides us directly with the medical information. Usually patients prefer that route than for us going and retrieving the medical information. It is very important to add that we need, and we emphasize the need to review imaging. So this is something not everyone likes to do, but it's the opportunity I want to take to explain how important it is. If you go to medical literature, you will find, and it's not just a Medix thing, it's a known scientific thing that has been proven, that if you have done a CT scan or an MRI or an X-ray or an ultrasound, in certain conditions, in over 33% of the cases, by having an additional radiologist look at them and give a second radiology opinion on that imaging by itself, it will lead to a change or to a new knowledge or understanding or conclusion that will change the diagnosis or the treatment. It's over 33%. It's huge. So if there is any imaging involved, we would always require to retrieve that imaging, and we would do that for the patient if he agrees to. We would approach the clinic or the hospital and get the MRI on a CD, and then it's very easy. Either we get it, or if the patient gets the CD, when he's at home, he uploads it through his computer in a secure way to a PACS system that is proprietary to Medix. And with a click of a button, his imaging is securely sent over the net to Medix. We then share that remotely, securely, with the best leading doctors around the world, radiologists and others, who can really look at the imaging. So we never just rely on papers, right? Patients are more than papers. Patients are people. Behind every case, story, and medical report, there is a human life. So we would look at imaging, we would speak to the patient, get all the medical information, and kick off the service from there.
So just to add to that, if I may. So as Sigal said, most of the time the patients, they retrieve their medical documents and they send it over to us, including radiology CDs. If it becomes a problem, if for whatever reason your medical center is not providing you with the results, we do communicate directly to the clinics, or we do send a letter as required to retrieve whatever results. It could be, it could be anything from blood results, just lab results, all the way to, pathology slides. So we will definitely do all that we can to help retrieve them, because as Sigal said, this is a very important part of the assessment.
Thank you. Okay, we have a couple more questions. Okay, how many Medix doctors are there and how many are based in Singapore? Perhaps, Sigal, you want to take us
I will
through
take
that?
it. Yes. So we have a very significant number of doctors, and I will share that Singapore is a hub, not just for Singapore, but for a lot of different countries. So we have Singaporean doctors servicing Singaporean patients. We have Malay doctors. We have Thai doctors. We have different doctors who support different countries, and we have a lot of different nurses. So actually, the Singaporean hub is a big one. We have a lot of doctors in different countries based on the populations that we serve. And we definitely have enough doctors to make sure that we service in a good, quality-driven way. And we get very good feedback from agents, from customers, from corporate. Demand is growing, and we adapt the number of doctors that we have to the needs, and we always have a very good buffer. And I'm very proud of my doctors. They're tremendous, and they really wake up every morning to make a difference. They're so engaged. And sometimes we have a big quantity of doctors, but I'm proud to say we have more than quantity. We have great quality.
Thank you, Sigal. Okay, let's cover the last couple of questions. How can I access Medix if my policy doesn't have it? Can I pay to access it? Perhaps Dr. Allen, you can answer the first question.
So I think it's probably better answered by Medix than maybe Sigal.
I will take this question, okay? Because and I'm not going to do this, but I can tell you very simply, you can approach us. It costs a huge amount of money because the service is a very high investment service. But because I feel that my interest is not to get people who would privately pay huge amounts of money, I would turn it around, and I can say it because I'm not AIA and I don't care, right? But my word to you is go get the right plan, and then you'll get access to Medix, because it's the much more financially smart way to have access to Medix. So make sure you have the right protection, buy the right AIA plan, speak to your financial advisor, and you'll get access to Medix. I hope you're okay with that.
Yeah, thank you.
Thank you. So I think that, that's a burning question from a lot of our viewers today. So I think the first thing that is going to happen after the end of this webinar would be everyone's going to speed dial their financial services consultant, right, Warren? To check. The phones will be ringing to check if their policies provide the Medix service. So again,
I would like to add one more sentence. The whole purpose is for people to understand that if you own the right policy, the right AIA policy, you are protected from a financial perspective, but you're protected from a health perspective. You will have access to independent service, and this is what I'm proud of. I would like people who are watching this video and financial advisors to understand that they make a difference, that they stand there, and by selling and making sure that their customers have access to the right policy, they're ensuring their financial capability to cover for healthcare, but they also ensure that they have access to the best possible medical solutions in the fastest way. So what is needed is just to hold the right AIA policy and make sure you stay healthy and safe. And then, God forbid you can just approach us.
Thank you, Sigal. I think we have time for one last question. Okay, is there a recourse if the Medix patient passes on or the patient's situation deteriorates? Perhaps,
not sure
Sigal,
I understand the question. Can you maybe explain the question? Because I'm not sure I understand the question.
Okay, could we go back up to the question, please? So I'll repeat it again and I'll explain it a little. So is there a recourse if a Medix patient passes on or if the patient's situation deteriorates? So probably the first question would be probably maybe something covered under the life policy for Warren.
Yeah, I'm not too sure where recourse in terms of legal recourse against someone or...
Yeah, so maybe, perhaps whoever wrote in that question, we probably need a little bit of clarification. You might want to contact us separately and we'll be happy to answer that question. And looking at the time, do we have time for any more questions?
There's one
Okay.
question on overseas treatment, I think.
Oh yeah, there was a question on overseas treatment. Perhaps we could go to that. Yes. If the treatment needs to be done overseas as recommended by Medix, who will cover the travel expenses and are there implications for the customer?
Okay, so I'm very happy to take this, if I may, to start, and then I'll hand it over back to you guys. If you live in Singapore, really, in 99.99999% of the cases, there would really no need be to travel abroad. I think that a lot of people want to travel to Singapore for healthcare because the healthcare situation and capabilities in Singapore are of the highest in the world. And I'm even proud to say that even orphan diseases and rare diseases have you have some good capabilities in Singapore. I'm proud to say that just look at the COVID-19 situation, right? Who's in the world out of control, so difficult to manage. Singapore has done really well with the lowest mortality rates among so many different countries. So first of all, be very proud of your Singaporean healthcare system. It's accessible. It's too expensive, way too expensive, but that's another discussion we don't need to have right now. But it's very good quality. It's just about knowing how to walk through the maze of the healthcare system, making sure you make the right decisions. But I really don't think you will find Medix recommending you, if you live in Singapore, to go abroad, because we would feel in most cases it's completely unnecessary. You have access and you have locally what it needs to make sure you stay healthy and keep healthy or cure your disease.
Thank you, Sigal. I think that's all the time we have. So unfortunately, we do have a lot more questions and we're unable to answer all of them. So what we can do is, if you can share, we'll share with you more we'll look to share with you more information on our social pages, and this session will also be recorded so you can review it again. But more importantly, I think you should reach out to your financial services consultant if you have more questions, and we'll get back to you on it. Particularly, I think there were some questions on Medix and White Coat and the excess, and I think many people are still asking which policies can they upgrade. So I think a lot of the questions, please contact your financial services consultant. The information will be on the screen after this. And lastly, you can always go to aia.com.sg under the section of Medix, under our partner services within the tab Help and Support, AIA Health Shield Support. Before we end the session, are there any last words from the panelists?
Well, maybe I can start. Stay healthy. I think that's most important. Of course, having the right plans is definitely critical in terms of care. And most of us staying in Singapore for the last decades know that medical cost is not getting any cheaper. So talk to your advisor. Get the right advice and get the right plan. Yeah.
Thank you, Warren.
And if you do get diagnosed with something, or you do have a condition that is confusing for you, and you happen to know Warren, or you have an AIA plan, please remember that you can contact Medix, and we will help you understand what's going on. We will help you to know where to go next.
I'll just repeat what I said earlier, which is if you have a condition which you think is serious, or a doctor is proposing that you undergo a procedure which is significant, if you have access to Medix, I would strongly encourage you to contact the service and at least get some additional advice.
Thank you to our panelists, and I hope, Sigal, do you have any last words you want to share with our customers?
Sure. So always remember, the most important, valuable asset you have is your life, is your health. And it's all about your life and making sure that you have access to what is best, which is, in our opinion, what you deserve. So stay healthy, keep safe, and don't forget that we wake up every morning to be there for you in case of need. And thank you very much for having me.
Thank you, Sigal. And thank you once again, everyone. Thank you, our panelists. We hope this session was extremely helpful for you and insightful. And once again, from AIA, we wish you to live healthier, longer, better lives. Thank you.